Dr. Nan. I'm here to talk to you about your catheter care after undergoing the Rezum procedure. When you wake up from the procedure, you will have a catheter that's draining your bladder. It will look something like this. Now, as you can see, this is a hollow plastic tube that drains your bladder. It is held by a balloon that we inflate. The catheter is held by a balloon that inflates, as you can see here. And this balloon will hang in the bladder, and that's the only thing that will be holding the catheter in place. And you can see by the shape of the balloon that this can irritate the inner wall of the bladder. And this is where you might experience some discomfort. It's very important to understand what to expect when you have a catheter in place. And many patients are quite alarmed at various things that can happen. So it's very important that you understand what can happen. The first thing is you can develop a lot of spasm and pain, unfortunately, from the catheter. And that's because, as I demonstrated before, it's due to the balloon. You can take some pain medication that I prescribe to you, or you can just put up with it, if you will. Other times it can settle, and over time it will get better. Unfortunately, for some patients, it will continue, and it will continue until the catheter is in. And unfortunately, you'll just have to put up with the catheter until I am able to remove it. Now, having said that, a lot of other things can happen with the catheter. One particular thing is something called bypassing. And this is when urine goes around the catheter. As you can see below, if you look at this model with the penis here and the catheter, the red catheter coming out, urine can leak around the tip of the penis and spill into your undergarments. So it's important to wear a liner or some type of pad to absorb the urine. And that is not an indication that something is wrong. It just means that the bladder is increasing its pressure and causing the urine to go around the catheter. And as long as the catheter is still draining urine, you don't have to worry about it. It's just an inconvenience, unfortunately, because urine will leak around it. Another thing that can happen with the catheter is bleeding. It takes a little bit of blood to make the urine really red. And you can have bleeding around the catheter or blood in the urine, and the urine can look quite red. Don't be too alarmed, again, because it is par for the course for a catheter. Just drink lots of water to make sure that it doesn't clot and it flushes out, and wear, again, pads to make sure that it doesn't soil your undergarments. And as long as the catheter is draining, you don't have to worry about it. In addition, a lot of patients experience some pain at the tip of the catheter or some irritation. Again, that's due to the balloon of the catheter, where the pain is being referred down to the tip of the penis. And you just have to put up with it or take the pain medication that could help. I'd like to talk about how to look after your catheter. You might have recalled waking up after the Rezum procedure, and you'll have a catheter connected to a bag that's connected to your leg. And it's very important that this catheter has no tension to it. This is a no-no. You have to have slack when you are wearing the catheter. There must be absolutely no tension in the catheter. Keeping this without any tension can be done with a piece of tape, which we'll demonstrate. You can take any type of medical tape and apply it to the skin, secure the catheter over the tape, and then secure another tape over that to secure it to the leg. And now you can see that the catheter has no tension on it. So over time, your catheter will start to fill and get full of urine. How do you drain it? Well, in the drainage bag, there'll be something at the bottom, a little tap, and that's where you can loosen it, and you loosen it over either the toilet bowl or in a container, and you can just empty the urine from there. And then once all the urine is emptied, you can tighten it back, and then the bag will start to fill up again. The capacity of the leg bag during the day is only about 2 cups. We don't want to interrupt your sleep, so it's good to change the bag to what we call as an overnight bag, which holds more urine so you don't have to wake up to drain it all the time. And the drainage tube is longer, so it gives you more flexibility in bed. So to change the bag, number 1, you have to wash your hands. Make sure they don't have to be sterile, but they have to be clean. Once your hands are clean, take the catheter and squeeze or kink the catheter so urine doesn't drain from it. And then you can release it from the attachment. And then make sure you clean the area with an alcohol swab that you can get from any drugstore and attach the tube to the catheter. And you just insert it so that it forms a good seal. Also, you want to make sure that this catheter bag is also clean with some alcohol wipes as well. You also want to make sure that with the night bag, the catheter again is on slack and it's secure with an adhesive to your leg. So it's very important that you grab a piece of tape in order to secure the catheter, in order that there be no tension on the catheter. Actually, when the overnight bag is on, take the leg bag off, cap it, and you can take it off the leg. It's always good to wash the tips with the alcohol swipe to keep everything clean. Now it's very important to stay clean while the catheter is in. Please take a shower every day. Not a bath, but a shower. You can take a shower with the catheter in place, but of course the leg bag is going to get wet. And if you can see here, the best thing to do is to take the bottom strap off so that it can stay dry. Take a shower like this. Again, make sure there's no slack, there's no tension on the catheter and lots of slack, and take your shower. Once the shower is done, replace the top band with the dry band, dry the other band, and then once it's dry, place it on the lower part of the leg. Now it's also important to keep the catheter clean from the end of the penis to the bag. To do that, it's important to clean it on a regular basis or as necessary. Now, as we will demonstrate here, what you do is you hold the catheter at the tip of the penis so there's no tension on it again, and then you take a wet rag and you just clean the catheter away from the tip of the penis. And then after that, you take a dry rag and dry the catheter after that. And do that as many times as necessary in order to get the catheter and any tissue debris off. And finally, what are some signs of emergencies or concerns? If you start to develop a fever and you have to take your temperature and it's greater than 38 degrees, then that's a sign of infection. And you should go to your nearest emergency department or call the number that you were given to your urologist or to me. And lastly, always make sure the catheter is draining. If there is no urine coming out of the catheter into the bag, then the catheter can be blocked. And that requires irrigation of the catheter that you can't do at home. You have to call your contact number, come to the hospital to have a health professional irrigate the catheter. And it's very important that gets done promptly so that it will minimize pain and discomfort. Thank you for your attention.